If you look at the word A-N-A-T-O-M-Y, tome. Tome means to cut. Section, cut. And ana is actually body. So anatomy actually means cutting the body. And that is one of the prime methods by which we are going to learn anatomy. So that's what actually anatomy means. How it is derived, the word is derived. But there is an Indian touch to it as well. Sanskrit word, ana-atmi. So thing without soul. That means, are we studying a dead subject? Not at all. Not at all. It is just an-atmi without soul. To just understand the meaning. Anatomy means to cut the body, and we can't cut a living body to learn anatomy. So therefore dead. However, the subject is very lively, as you will find when you experience it. But that's an Indian touch, Sanskrit word. But actually anatomy came from the Greek word anatome, which means part cutting. So cutting a part is anatome. And a related term, which is Latin, is dissection, which is a method of learning anatomy, which comes from dissecare, which also means to cut. So if you see, it is more or less synonymous. However, but the words are different. So once you see in bracket Greek and Latin, this is what you are going to feel. That all the terms that you are learning right now, so many terms in anatomy, then physiology, biochemistry, and then throughout your career in medicine, will sound Greek and Latin to you. And in the real sense, they are Greek and Latin only. Most of the words are Greek and Latin. But the phrase that it sounds Greek and Latin to me, that means you don't understand anything, is also true. So that's what anatomy is. And as he said, morphological features of gross and microscopic structures. So the term gross, as it features in here, subdivisions of anatomy. So the first subdivision that is listed there is cadaveric anatomy or macroscopic anatomy, which is also referred to as gross anatomy. So what do you mean by gross? Gross is something which is large, which can be studied with the naked eye. You don't require any instruments or aids to magnify the structures and learn them. And that's why, okay, if you are having the habit of clicking photographs, don't do it. This is all for you, we'll share with you. Okay, so no need to actually click photographs, because that distracts the teachers. So we'll give everything to you. All the teachers who will use PowerPoint presentation will share the PDF of the PowerPoint presentation, and the department will share it with you. So there is no need of clicking photographs. If you have the habit of scribbling down notes, you are welcome to scribble down notes, because that is your way of learning. Photography may also be your way of learning, but that is not good, because we are giving it to you. So coming to cadaveric anatomy, because this anatomy is learnt on cadavers, so that's also referred to as cadaveric anatomy. So gross anatomy, macroscopic. Macro is large. Scope means to visualize or to view. So when we visualize things with the naked eye, macroscopic, and it is visualized on the cadavers, so cadaveric, and gross means large. So gross anatomy. So synonymous terms. So this is the first subdivision of anatomy. Now this cadaveric anatomy can be learnt in two different ways. One is by dividing the body into different regions. So when we study the anatomy of the body by dividing it into different regions, it's called as regional anatomy. For example, the trunk, the head, the neck, the limbs or the appendages. So we study the anatomy by regions. So that's why regional anatomy. The other way of learning anatomy is by systems. So the word system now will require some definition. So what do you understand by a system? Any thoughts? What do you understand by a system? Number of organs work together, that is called as a system, which they perform the common function. Very good. So what does an organ mean now? The next question. Yes. So number of tissues which are grouped together form an organ, they perform a common function, that is called as an organ. So now what is a tissue? A group of cells. Now any group of cells is a tissue which have a common structure and function? No, not necessarily. They are common origin, okay? Now, when there are cells, is there intercellular substance? So, do not forget the word intercellular substance when you define any tissue. Okay, so cells and intercellular substance. So, that's a tissue. And of course, the micro unit is cell. Cell is a structural and functional unit of any organ, and cell is composed of various organelles. So, the hierarchy is cells, tissues make organs make systems, and many systems form the entire organism or the body. So, that's the hierarchy. So, when we learn anatomy of those various systems, then it's referred to as systemic anatomy. Got it? Now, systemic anatomy, based on which system we are learning, can be classified further. So, what we are learning here is classification. So, in anatomy, it's a norm. Whatever you learn, you will learn classification. Why is it so? It is for ease of learning and understanding. Otherwise, human body is one. But it is just for ease of understanding and learning that it is divided into various parts. So, systemic anatomy, if the study of bones is osteology. So, all these words are Greek. Logos is study. Osteo refers to bone. So, study of bones is osteology. Study of muscles is myology. Study of joints is arthrology. Study of vessels is angiology. Study of nerves is neurology. And study of organs is splanchnology. Splanchnos is organs. The Latin term is viscera. Familiar with the term viscera? So, viscera is same as organs. Splanchnos is same as organ. So, study of organs is splanchnology. So, these are a few systems that are there. But what we follow, because we study it on cadavers, it is easier for us to learn regional anatomy rather than systemic anatomy. Whereas in physiology and biochemistry, you learn by systems. So, nervous system, musculoskeletal system, like that. Coming to other subdivisions of anatomy. So, that was the main subdivision, gross anatomy or cadaveric anatomy. So, there are other subdivisions of anatomy that we all will be learning through this year. The first one is general anatomy. So, when we are learning in this session anatomical terms, it's a part of the general anatomy. So, if there is a general anatomy, general means anything that is generalized, common. So, opposite of general is specific or special, correct? So, others are specific. So, general anatomy is that branch of subdivision of anatomy where we will learn general features of all the various systems. So, for example, general anatomy of bone. So, you have a session on Saturday, general anatomy of bone. So, we will be learning common features of what bones are made up of. General anatomy of muscle, general anatomy of nerve, general anatomy of vessels, joints, etc. So, that is general anatomy. Now, we said anatomy is learned in dead cadavers. But there is a subdivision of anatomy that is called as living anatomy. How many of you believe that anatomy can be learned on living human beings? I am seeing 1 hand, 2 hands, 3 hands, 4 hands, 5 hands. Bas. Others believe that anatomy cannot be learned in a living human being. Correct? Am I to assume that? Am I to assume that? Or you are hesitant, not uncertain? Uncertain. Okay. So, those who said anatomy can be learnt in a living human being, can you elaborate? Can anyone elaborate? Yes. Acha, you can give anesthesia and then learn anatomy. Ho, okay. Digital image MRI from a living person, so that is living anatomy. Okay, what do you feel? The same thing. Okay, very good. Okay, so he says, he is given a different angle. He says that in a living being, whatever is visible can be studied, and that is living anatomy. Yes, on the back. By palpating nerves, one can learn living anatomy. Palpating means? By touching it, that by feeling it. Okay. Now, I am a living human being, you are a living human being. If you want to learn anatomy of your own self, can you learn? By looking at your own body? By touching your own body? Can you learn anatomy by looking at others' body? Neighbor, friends, or volunteers? Healthy human volunteers. So whatever you will be applying on patients, what you are doing? You are actually applying whatever anatomy you have learnt on patients. Same thing you can learn on a living human being who has volunteered to be a subject for learning anatomy. So that subdivision is living anatomy. And as he rightly said, palpation is one method of learning, that is by feeling. By merely seeing, looking, that's called as inspection, inspecting the body. That's the first step, seeing. Second step is feeling. Third step is percussing and looking at the sound or hearing the sound. What kind of sound is emanated from that particular area of the body? That's percussing. And the fourth one is using a stethoscope, that is to hear, to listen. That's called as auscultation. You can also put your ears on a particular part of the body and listen to the sounds coming from within the body. But there is an aid available, stethoscope, which everyone will proudly purchase and wear and don on around their neck in a few days' time. Because you will be learning in physiology, clinical physiology. So coming back to that is living anatomy. Third term is developmental anatomy. As the name suggests, developmental. Human organism, any organism undergoes development with time. So study of development of a human being is called as developmental anatomy, and in bracket you can see embryology. That means it's synonymous with embryology. However, there is a little difference. Embryo is defined at a certain period. That till this much age, the entity is called as embryo. So study of that embryo is called as embryology. But our study of development does not restrict to embryo only. The embryo grows into a fetus. Then the fetus is delivered into a baby. The baby still develops and grows, no? And still we continue to learn that development. That's why developmental anatomy is a better term, a larger term to encompass that. Next is microscopic, as I said. So we require some aid to magnify the structures and look at the structure of that particular cell or tissue. So study of anatomy using a microscope is called as microscopic anatomy, and bracket we have said histology. Microscopic anatomy is a wider term, larger term, because we study intricacies, ultra structure of cells. So cell organelles can be studied. That's why microscopic anatomy. The light microscope that we will be using to study, we can see only outline of the cells, features of the cells, and groups of cells, that is tissues and intercellular substance. That's why histology was the original term that is used. But with the advent of microscopes, which have got very high magnifications, like the electron microscope, which can study details of the cells, that's why the term now microscopic anatomy. And that's why microanatomy is the term that we will be using. Microanatomy. The journal that you will be completing, drawing diagrams, will be microanatomy journal. Synonymously called as histology, but it's actually microanatomy. Topographic anatomy. Topography is surface. Whatever we can see and feel on the surface is topographic anatomy, and that's why it's also called as surface anatomy. So you will be asked to learn about how internal structures can be projected on the surface. So for example, when you have pain in abdomen, which commonly is referred to as pet dukh raha hai. But pet is not stomach. Pet is abdomen for that person. Then you as a doctor will feel the person's pet and then try to decipher if the pain is here, then what are the likely organs that would have been the cause for the pain. So that is topographic anatomy. So to be able to tell us that this is the organ that is lying in this area of the abdomen, this area, and likewise. Or the bony prominence that you are feeling here is part of this bone. That study is called as surface anatomy. And when you learn it on a living being, it is living anatomy. Yes. So therefore, topographic anatomy can be learned on cadavers also. Therefore, it's a separate thing that is there. Topographic anatomy can be learned on a mummified body also. Okay. So therefore, a separate subdivision. It used to be learned that way for years together, and still it is being learned. But what you will be learning is surface and living anatomy together. Some on the cadavers, before you dissect, you first learn the surface anatomy of the given part, then you start dissecting. Then radiographic anatomy, as the name suggests, study of anatomy using radiographic techniques like MRI, CT scan, X-rays is radiographic anatomy. Okay, so actually it is in a living being, but you are using special techniques. Comparative anatomy, as the name suggests, you are going to compare anatomy of one organism with the other. Humans have evolved from lower animals. So we want to compare anatomy of, say, a mammal, other mammal as compared to human being. A four-legged animal walking on four limbs. Humans have evolved to become bipedal, so that the upper limbs are free to move, because upper limbs have to function for grasping, reaching out for an object. So that comparative anatomy is study of anatomy of two organisms and comparing structures. Physical anthropology is to do something with anatomy of races. Mongoloid race, Negroid race, Caucasoid race, Aryans, Dravidians, Western India, Southern India, Northern India, etc., etc. So anatomical features of people belonging to a particular race is different. So if you want to study differences in anatomy of various parts of the body of these people, that is physical anthropology. For example, if I want to study the head circumference of all of you, you belong to different regions of the country, you belong to different lineages. Okay, so accordingly, if I want to study, I can say head circumference of students, first MBBS students. So that is physical anthropology. And then I will, group you, and then see comparative values, something like that. We can study differences between males and females. That way. Forensic anatomy. How many of you are interested in those kind of thrillers that you watch? Many of you, right? And I don't know whether your generation is familiar. Kuch to gadbad hai. And you know Salunke? Correct. So forensic anatomy is that branch. So studying medico-legal aspects using anatomical specimens, that is forensic anatomy. So it's a branch of forensic science. It's more dealt, of course, with forensic medicine and toxicology department, but anatomy department also is involved to some extent in this. Applied anatomy. Why are we learning anatomy? Because we should be able to apply the knowledge on patients. For what purposes? For what purposes? Why do we want to apply anatomy on a patient? Diagnosis, very good. Treatment, very good. Surgery as a part of treatment, very good. But before diagnosis, what do you want to do? How will you arrive at a diagnosis? Observe. That's the most important thing. So whatever you have learned in anatomy, whether it is cadaveric anatomy, microscopic anatomy, any field of anatomy or living anatomy, you have to apply that on the patient. Firstly, for examining the patient. First, you will listen to what the patient has to say. The next thing that you do is examining the patient. So, examination of the patient, arriving at a diagnosis, advising proper investigations, and finally offering treatment, whether it is medical treatment or surgical treatment. Now, in this context, when you do this, apply the knowledge of anatomy on the bedside. Always when you open a clinic, there will be a bed in the clinic. Bed is equal to bend. Bend means cline, angle, recline, incline is all angle, no? So that's why clinical anatomy. So when you utilize the knowledge of anatomy and apply it on the bedside, it's called as clinical anatomy. And when you apply this knowledge of anatomy for performing surgery, then it's called as surgical anatomy. Okay, so applied anatomy can have various subdivisions. Clinical anatomy and surgical anatomy these are two subdivisions. And finally, experimental anatomy. You can do a lot of experiments on tissues. So that's experimental anatomy. Because these are the various subdivisions of anatomy. So we have spent almost 15 minutes discussing the various subdivisions of anatomy. So if you are clear about this, then we will move further on the principles of anatomical nomenclature. So this is the first formal document or a meeting that came out with a document where principles of naming structures of the body came out with. This is called as Basel Nomina Anatomica, BNA. And you see the year 1895. That's the first time when people came together, discussed, and came out with these principles. Now, where is this Basel? Any idea? Which part of the world? Poland, okay. You are very good in the continent is correct. Europe. Yes. Switzerland, very good. Okay. You can Google and even find out immediately. Basel is in Switzerland. So that's the place where people met, and that's why this is called a Basel Nomina Anatomica. So what are the rules? Let's look at those rules one by one. Each part shall have only one name. That has to be universal. Today you will call me Praveen, somebody else calls me by other name. Will not know who I am. Otherwise, we have nickname, we have got pet names, okay, name at the home, somebody calling us by a particular name, etc., etc. Nahi chalega. One has to be, passport pe ek hi naam hota hai. Correct? So that's each part shall have only one name. That's the first rule. Each term shall be in Latin. So we have to speak the same language. Correct? Now, if we have to stand, or if we have to have a standing in the world, we need to speak a common language that the world understands. Okay. Of course, there are countries which may have different thought processes, and therefore they stick to the language that they want to speak. That's a different issue. India is a secular country. Forget about secular. India is a country with multiple languages. Now, if in India so many states and union territories are there, and each state and union territory decides, we will learn medicine in this language only. And you have come here and learned here, and you will go back somewhere and practice. How is it going to, help you out? Difficult. Okay. So, the correct concept should be, you should learn in your own language. But the teaching will not be in that language. The learning can happen in that language. So, there can be resources made available in that language. Understanding can happen in that language. But teaching and assessment will have to be in a universal language. Yeah, you had something to say. Okay. So, he is concentrating on that sentence. I am speaking something else. Very good. So, why Latin is decided is the question that he has answered. Latin is a dead language. But what do you mean by dead language? Not spoken. No more used. Acha. So if it is no more used, then why it was decided? Good thought processes, okay. Every batch with whom I interact, no, I get different responses of this statement. And this invokes actually lots of responses. Latin is equal to lateral, is equal to lattice, is equal to latissimus. Lateral, lattice is wide. So Latin is a language that is widely spoken. Widely spoken. Latin America, entire continent is there. Latin America, Latin is spoken. Okay. You go to the country, Spain, Latin, Spanish is Latin. So in 1895, I'm not saying right now, but right now also it may be the same. 1895, Latin was the most widely spoken language. So because it was the most widely spoken language, whether it is dead, no change, etc., whatever theories are there, but the reason why Latin was chosen was, Latin was the most widely spoken language at that time. Okay, so that is the meaning of the term Latin, wide, and that's why Latin. And there has to be one language. Each term shall be as short and simple as possible. Terms shall be merely memory signs. So we can recall them easily. Memory signs, that's why memory signs. Related terms shall be similar. So, if there is an artery in the thigh, it is referred to as femoral artery. Because femur is the bone of the thigh, so femoral is an adjective. So a vein of that region has to be referred to with a similar prefix, that is femoral vein. And nerve of that region is referred to as femoral nerve. So what it means is related terms shall be similar. Now if we have to use adjectives as prefix or postfix, suffix to a particular term, then they can be arranged as opposites. Like major and minor, superior and inferior. So they are opposites. Major is large, minor is small. Superior is above and inferior is below. So these are the 6 principles that were laid down in Basel in 1895. Which one? 1, 2, 3, 4. Terms shall be merely memory signs. Very good. Memory signs means something which we can recall very easily. So, if a structure looks like a pen, nib of a pen, it's called as calamus scriptorius, which means the nib of a pen. So memory signs. If something looks like a tree, branching of a tree, it's called as arbor vitae, branching of a tree. Something like that. Arbor vitae cerebelli. So tree of life. Something like that. Memory signs. Okay. Shall we go ahead? Now we come to the actual. So having learned the principles of nomenclature, the most important thing that is to be learned and remembered throughout is the term anatomical position. What do you mean by anatomical position? Anatomical position is that position of the human body in which the person is standing erect, the upper limb by the side of the trunk, both upper limbs, the palm facing forward, the feet touching each other and the toes facing forward, and the eyes are looking at the horizon. That is infinity. Horizon means infinity. So this position of the human body is called as anatomical position. Did you get this? So anatomical position is that position of the human body in which the person is standing erect, the upper limb by the side of the trunk and the palm facing forwards, the feet touching each other and the toes facing forward, and the eyes are looking at horizon. This position of the body is called as anatomical position. Why do we need to know this anatomical position? Because all the parts of the human body are described as if they were in anatomical position. But can we learn cadaveric anatomy in anatomical position? Will the cadaver be made erect for you to dissect? No. The cadaver will always lie on the table because there is no life. It has to be supported. But still, all the terms that are used for the body parts are used as if they were in anatomical position. Got it? Can anybody repeat what anatomical position is? Yes. Okay. Thumbs are not facing opposite, palm is facing forward. That is what is important. Because the limbs can be by the side of the trunk with the palm facing inwards, backwards, etc. also. But it has to face forward. Got it? Right. Very good. Supine position. When we lie on the back, it's called as supine position. When we lie down on the back is supine position. When we lie down on the belly, it's called as prone position. So when you dissect the cadavers, it's supine position or prone position. Then comes anatomical planes. A vertical plane or a longitudinal plane which cuts the body into two equal halves, right half and left half. This is called as mid-sagittal or median plane, midline, median plane. Any plane which is parallel to the median plane is called as sagittal plane or parasagittal plane because it's parallel to the suture of the skull, which is referred to as sagittal suture. The plane, median plane, midline, cutting the body into right and left halves. Parasagittal is parallel to this median plane. Then, a perpendicular plane to this median plane, which cuts the body into a front half and a back half. And this plane is parallel to the coronal suture of the skull. This is called as coronal plane or frontal plane. This one. And since the body is three-dimensional, there has to be a third perpendicular plane, which is this. This is called as transverse plane or horizontal plane. Transverse because trans means across. Verse is vertical. So across the vertical is transverse. And horizontal because it is parallel to the horizon. That's why horizontal. Got it? So median plane, coronal plane and transverse plane. Any other plane of the body is referred to as oblique plane. Oblique plane. Because it doesn't fit into these perpendicular planes. So at any other angle, any plane will be there, it's referred to as oblique plane. Now let's come to terms depicting directions. Okay, I'll give you a cue. Planes. In the previous university exam, there was a 2-mark question. List the planes of the body. This was the answer that was expected. 4 planes. Median plane, frontal plane, transverse plane, oblique plane. Planes of the body. Terms depicting direction. Anything that is towards the head is called as superior. Towards the toes or tail actually is called as inferior. Towards the front is called as anterior. Towards the back is called as posterior. In the midline is called as median with ending with N. Away from the midline is lateral. Lateral. Not in the midline but close to the midline is called as medial. AL ending with L. So medial is not in the midline but close to the midline. Anything that is away from the midline is called as lateral. Got it? With reference to the limbs, the lower limb and the upper limb. The part of the limb close to the trunk is called as proximal. The part of the limb away from the trunk is called as distal. Got it? These are the terms depicted in this picture. Structures which are towards the surface of the body are referred to as superficial, and structures which are inside, away from the surface of the body, they are referred to as deep. With reference to the hand, the back of the hand, now this is back of the hand, okay, this one is back of the hand, because in anatomical position it is back. Posterior aspect is called as dorsum of the hand, anterior aspect is referred to as palm of the hand, palm and dorsum. In the foot, the front of the foot, which is facing actually above, that's called as dorsum of the foot. And the part of the foot which is facing the ground, touching the ground, is called as sole of the foot. So, peculiar or specific terms for hand and foot. Terms used in embryology. Now comes the confusion. The humans have evolved from lower animals, so that the picture of the dog is there here. So front in gross anatomy is anterior, but front in embryology, because embryo is bent, fetus is bent. Okay. So ventral is towards the belly and dorsal is towards the back in embryology. Cranial is towards the head. Cranium is the skull. So cranial or cephalic, which is head, rostral, which is actually beak. Synonymous terms. So anything towards the head is cranial, cephalic or rostral. Anything which is towards the tail, the fetus, the embryo has got a tail which disappears in human beings. So that's caudal. Got it? See there. If you said, so cranial actually in the dog will be anterior, no? Because it's in front. That's a different issue. Forget about that. Ventral, dorsal, cranial, caudal. These are 4 terms in embryology. Rostral is beak. Beak is towards the head. Terms used for organs. Interior is within. Exterior is outside. So outer surface of the organ is exterior. Inner aspect of the organ is interior. Invagination. Vagina means a sheath. You have seen a sword. The sword is kept inside the sheath. So that sheath is vagina. So if there is a protrusion within the organ, which is shown in this diagram, this is invagination. If there is a protrusion on the surface, that is evagination. E is outside, exterior. So this sheath is formed outside on the surface. This sheath is formed within the organ. That is invagination and this is evagination. And again with reference to the organ also, whatever is there on the surface is referred to as superficial, and whatever lies away from the surface deep inside, it's referred to as deep. Now there are certain other terms related to limbs, and terms to indicate side, terms pertaining to muscles and terms describing movements, which we'll be seeing in the next few slides. Term to indicate side is, side means lateral. Same side is ipsilateral. Same side is ipsilateral. And opposite side is contralateral. Contralateral. Got it? Now terms related to limbs. We have already dealt with proximal and distal. Closer to trunk is proximal, away from the trunk is distal. With reference to the upper limb, ulna is the medial bone of the forearm. So ulnar side is medial aspect of the upper limb. Tibial is tibial for lower limb. So tibia is the medial bone of the lower limb. Okay. Ipsilateral is same side, contralateral is opposite side. That means, if suppose I am saying that the liver is on the right side, the ascending colon is ipsilateral to the liver, which means it also lies on the right side. So same side. And spleen is contralateral to liver, is on the left side. So same side and opposite side. So coming to ulnar, which is medial aspect of the forearm, radial is lateral aspect of the upper limb. Tibial is medial aspect of the lower limb because it's a medial bone of the leg. And fibula is the lateral aspect, lateral bone, therefore it's the fibular aspect, the lateral aspect. Preaxial and postaxial, preaxial, that's pertaining to develop. The limb develops like this in an embryo. So this border of the limb, upper limb, is called as preaxial because the axis is like this. So pre is before and post is after. So preaxial border and postaxial is this border. So for the lower limb, it's the opposite way because upper limb has rotated outwards, lower limb has rotated inwards. I'll repeat it, okay? Preaxial, the concept you remember. Concept is both the limbs are offshoots like this. So there is an axis. Border which is above this axis is pre. Border which is below this axis is post. Upper limb gets rotated like this. So the outer axis becomes preaxial. Outer border becomes preaxial border. Inner border becomes postaxial for upper limb. Lower limb rotated inwards during development. So the preaxial border is the medial border and the postaxial is lateral border in the lower. The concept is this. Both the limbs were like this. Afterwards, rotation happened in the opposite direction. So that's the concept of preaxial and postaxial. Flexor surface and extensor surface. This is with respect to which group of muscles lies on that surface. So for the upper limb, the anterior surface is referred to as flexor surface because flexion means bending. So muscles which will bend will be in front. So this surface is called as flexor surface. Whereas the posterior surface is referred to as extensor surface. For the lower limb, it will be different depending on where the muscles are located. Palmar is with reference to the palm. Plantar is with reference to the sole. So structures lying on the palmar aspect, structures lying on the plantar aspect. So these are terms with reference to limbs. Radial. Radius is the bone of the upper limb which is laterally lying in the forearm. So lateral border of the upper limb is referred to as radial. Anything that lies on the palmar side is called as palmar. Anything that lies on the sole, towards the sole, is called as plantar. So this is a concept that you will have to read and understand. I will explain it for the last time, preaxial and postaxial. When the fetus develops, the limb develops as buds from the trunk. So this limb as a projection will develop like this. This is the axis of the limb. The border which is above towards the head is therefore preaxial. Border which is towards the tail is therefore postaxial. Lower limb also develops like this. Okay, but further development happens when the limb rotates. The upper limb rotates outwards, the lower limb rotates inwards. So therefore, lateral border of the upper limb is preaxial, medial border is postaxial. Opposite way for the lower limb because the rotation is in the opposite direction. Got it? So these are terms with reference to limbs. Terms with reference to muscles. This will be of course elaborated when there is general anatomy class also of muscle. Origin is that part of the muscle that is fixed during a movement. Insertion is that part of the muscle which moves. Belly is the fleshy portion of the muscle. Fleshy. How many of you eat non-veg? Many of you. Okay. So you eat flesh. Rich in protein. Flesh. Belly. Tendon is the white portion of the muscle which is fibrous. May not be eating that probably. Aponeurosis means flattened tendon. A tendon, white portion, which is flat, is aponeurosis. Raphe, when there is intermingling of muscle fibers, that part is called as raphe. You will not remember everything that you learned today. Just listen. Okay, you will have to read. Then this term you will encounter repeatedly when you learn particular things. Pertaining to movements now. Flexion and extension, opposites. Flexion means bending. Extension means straightening. Simple example is elbow. When we bend the elbow, this is flexion. When we straighten the elbow, this is extension. Very simple. Same way for the wrist, same way for the hip, the knee, etc. Flexion and extension. Right? Very simple. Bending is flexion and extension is straightening. The surface which bends is different for different joints. Okay. Then, if the limb is moved away from the midline, away from the trunk, this is called as abduction. To carry away is abduction. To carry towards is adduction. That's why when a person is kidnapped, the child was abducted, carried away, no? But nobody says the child was abducted, brought back. ऐसा नहीं बोलते, but that is adduction, to bring back. Then, rotation. That's the third axis of movement, vertical axis. So when the rotation is inwards or towards the midline, that's medial rotation. The rotation is away from the midline, it's lateral rotation. It's also referred to with the reference to upper limb. Outward rotation, that is lateral rotation. Inward rotation, that is medial rotation. Same way for the lower limb, it will be inward rotation is medial rotation, outward rotation is lateral rotation. Now, with reference to, there is two more movements which are shown here. Circumduction. When a person bowls, what movements are occurring? Extension, abduction, adduction, okay, and flexion again. So, combination of flexion, extension, adduction, abduction in a particular sequence, that is circumduction. Same thing can happen for the hip joint, lower limb. That is circumduction. No rotation is involved. The last movement that is depicted there is pronation and supination. Remember this now. Elbow has to be bent, flexed. In a flexed elbow, when the forearm moves in such a way that the palm faces upwards to receive something is supination. To give something is pronation, when the palm faces downwards. So in a flexed elbow, when the forearm moves in such a way that the palm faces upwards, it is called as supination. And when the palm faces downwards, it's called as pronation. So who gives? Who has more? Who has more? King. So kings pronate. Who receives? Who asks? Beggars. So beggars supinate. So kings pronate and beggars supine. That's supinate. That's particular for forearm movements. And for the thumb, there are peculiar movements. Apart from flexion, extension, adduction, abduction. Now thumb is at right angles to the other fingers. So the direction is different. But there is another movement which is most important. The thumb can touch the other fingers. So this is called as opposition. And getting it back is called as reposition. You will be learning details when you learn this part of the upper limb support. Yes. No, when you bend, it is not extension. When you bend, it is flexion. When you straighten, it is extension. So when you want to show biceps, you will bend. But when you want to show triceps, you won't bend. You will have to straighten. Only then you will be able to show triceps. With reference to the foot can walk on uneven ground, no? So it has to adjust. So rotation of the foot in such a way that the sole faces medially is called as inversion. When the sole faces laterally, it is called as eversion. So peculiar terms for foot. Head can straighten, extension, flexion. Head can bend sideways also. That's called as lateral flexion. Shoulder. One can elevate the shoulder. One can depress the shoulder. The jaw can be moved forwards and backwards. Protrusion and retrusion. So to summarize, what we have learned today is we learned what is the meaning of anatomy. We learned the various subdivisions of anatomy. We learned the principles of anatomical nomenclature, anatomical planes, terms depicting directions used in embryology, organs, certain other terms particularly with reference to limbs. So for movements, for muscles, for side and for joints, all these terms are the things that we learned today.